Hey everyone, and welcome to the last video lecture about how to structure your training sessions. More in particular, focus on how would you structure a program plan for improving strength or endurance. We'll start by speaking to stretching. So again, this is getting back to more like a per session sort of programming aspect. And ultimately, if you want to include stretching, it's good to do it after a little bit of a light warm-up. And this is just to allow the body some time to kind of get used to moving and get to a, let's say even like a resting state of flexibility to start with. That's because blood flow is occurring to the muscles. We get some vasodilation there, and again, the muscles can get a little bit of length as they warm up. And so from there, we can undergo a few different types of stretching, or I've even included a topic about rolling. But one of the main things we want to focus on is typically dynamic stretching. So before you actually start an activity, you do not want to undergo static stretching. Debatably, whether you do some proprioceptive neuromuscular facilitation type stretching or energy release stretching. We'll talk about when to use that. But again, if you're going to do any type of stretching before exercise, it's dynamic. Afterwards, for maintenance and just generally keeping flexibility and a good range of motion of your limbs, you'll typically then, after exercise or when you're cooling down a bit more, undergo some static stretching or PNF type stretching. So what are the differences, and when do we want to employ all these different modes of facilitating some increased or maintenance of range of motion of our body limbs around our joints? Well, if we're starting, again, dynamic, but stretching is when, I should speak to what dynamic is. So dynamic stretching is when you just kind of use some light movement throughout a range of motion and just kind of slowly increasing that range of motion to help the body warm up. So just that moving gets your blood flowing, as you know, get all those hormones and preparatory pre-exercise physiological state of our body ready. But then after you're done, static stretching is probably what we're most commonly aware of or know about. Stretching is essentially where you slowly ease into a position and get to that endpoint range of motion and hold for about 10 to 20 seconds. Typically, you don't want to be holding a stretch longer than 30 seconds. That can start straining your muscles. And again, you don't want to push to the point where you feel uncomfortable or it's painful. Okay, when you're stretching, you really want to relax and allow the body to reach that end point and slowly ease into a greater range of motion if your body is able to. Again, you don't want to push this. And so I specifically crossed out ballistic stretching. There's very few times, other than maybe sports-specific type stretching or warming up, where you might use ballistic movements, but typically to increase or maintain range of motion, you usually wouldn't use that. And PNF stretching is kind of a unique one where I use it quite a bit in active rehabilitative type programs because the amount of flexibility or range of motion that you get from using this technique is quite significant, but it really relies on some of the more neurological side of stretching. And so I find it's a good temporary fix if your nervous system is primarily holding your range of motion back versus the muscle, say like tendon or muscle itself or connective tissue around the muscle, creating limitations in your range of motion. So to speak to that, essentially the way PNF stretching works is you get into, say I wanted to stretch the back of my arm, so I'd cross my shoulder, so like rear delts, and just cross the back of my shoulder joint. So I pull my arm across my body. This would be a static stretch, so I'd hold this position for about 10 to 20 seconds. If I was to do a P and F stretch, I bring my arm across, not all the way, but then I give a backwards push or activation of the back part of my muscle to try to get those muscles, for example, like external rotators of the rotator cuff, my rear deltoid, lat, even a little bit, actively pulling back and contracting. And after those muscles have contracted, I let my arm come down in front of my body, relax again. I probably would have held or kept things active for about 10 seconds. Very quick, like 2-second shakeout. And then I get into a static passive stretch. And so typically what you'll find is it uses this kind of neurological thing where it'll help the muscle shut down and not hold as much tone or guarding in the muscle after you've had that moment of contracting, flexing, and then again you relax and you get a little bit more range of motion. It's a very cool party trick because you get a good deal of range of motion out of it. But again, it's a bit more temporary, I come to find, relative to what you get from static stretching or potentially even foam rolling. So foam rolling is used fairly often for a number of different things. It's quite common now and heavily encouraged and supported by a lot of health and fitness practitioners out there. However, research has been somewhat limited in supporting a lot of claims about foam rolling. So one of the great things about self-myofascial release, and again, maybe to speak to this, just foam rollers are the big cylindrical looking things. Sometimes they got lots of bumps on them, and sometimes you can have like a stick with some beads on there. But foam rolling in and of itself is just a means of self-myofascial release. So myo is muscle and fascia is this connective tissue that's around the muscle. And the idea is if you can kind of move some of the skin and connective tissue away from some of the muscle, that you get a lot of benefits. There's definitely some neurological benefits as far as causing the muscle to relax. And so sure enough, we see some increases in range of motion when this is done after exercise, so as a maintenance thing. Very similar to static stretching, if you do a lot of foam rolling before exercise, it typically decreases a lot of performance. It doesn't necessarily increase. And again, if you do it afterwards, there's some indication that it'll decrease pain perception, which might help with the perception of DOMS, or delayed onset muscle soreness, after you work out. Mitigate that a bit, but ultimately the main thing that works for DOMS is time. You just need enough time to allow your body to recover after exercise before DOMS goes away. So that's the main thing. But having said all of that, again, this is just for general health and fitness. There are very specific situations. For example, if you are a rehabilitative type person, so like if you are going to active rehab or have an injury, your physio or kinesiologist might prescribe or suggest some of these before you get into activity, and that would be on a case-by-case basis. But again, for general performance and general health and fitness, these are mostly done afterwards, dynamic stretching being the primary one that you would do before exercise. Okay, they all, improve flexibility to some degree. They're, depending on who you are and what's going on, the differences might be negligible. Okay. I think we spoke mostly about this on the last slide already. Again, just you don't want to static stretch beforehand. Dynamic stretch is the way to go. And that there's no large tie to increases in jumping, powerlifting strength, etc., performance in general with those. But injuries and maybe cases of extreme range of motion, that's when we really want to include range of motion work. I think it is important to note, though, I feel like I've mentioned it before, but just to ensure that I've said it, stretching does not guarantee or or have much evidence to support that it actually reduces injury. In fact, there's more evidence probably to support the fact that overstretching and being too flexible will, first of all, potentially cause more injury. And there's some evidence to support that if you're hypermobile or have too much range of motion, it actually takes longer for you to recover from injury. So again, although it might be somewhat prevalent thought out there as far as stretching helps decrease injury, or having really, really good flexibility all the time decreases injury, that's not necessarily true nor supported by evidence to date. So, effects of warming up and cooling down. So we dealt with stretching. Again, we typically don't do it before. If we're to do a little bit of dynamic stretching before, that's after our warm-up. But what is a warm-up? And then also, what is a cool down? And how and when do we use these as far as putting them into a session? Well, most of the time we want some sort of active warm-up before we start doing our physical activity. And a lot of the underlying premise of this is for physiological or physical part of prepping us for exercise. As we know, just thinking about exercise can start our body releasing hormones to start prepping us to get ready to work out. But that being said, our actual warming up goes a long way. Generally, it doesn't necessarily have to be related to the activity, but anything that will just get our heart rate up a little bit above resting is sufficient, and for about 10 minutes is good. If you had an absolute positive minimum amount of time to do any sort of warm-up, 3 to 5 minutes is the absolute minimum before you want to get moving. Again, this should be a gradual ramp up into whatever desired intensity you want for your warm-up. Again, nothing too much more than 60% of your heart rate max. And then sport specific, if you use some sort of skill specific task, that's really helpful too, and that goes along the lines of your dynamic stretching. You want to try to keep that as sport specific or task specific as possible. Okay. And again, the reason we warm up, increase our body temperature, part of that is to help our muscles go from somewhat maybe of a resting to slightly contracted state into one that's a bit more pliable. Our nerve conduction velocity increases, so that allows our performance to increase. Our force velocity relationship of muscle allows better performance. We start freeing up some energy. This is both for anaerobic and to some degree aerobic energy. So like free fatty acids, and while getting too hot for an endurance athlete is not ideal, having some increased temperature, at least to start, can be beneficial. I'll leave it at that. So good. From our deoxyhemoglobin curves, we get increased oxygen delivery occurring to our tissues when we start increasing temperature. And we start switching to more anaerobic sources. Yeah. Okay, and again, performance related. So if I was to sum that up again, so just to be a little bit more clear, increased body temperature has a number of performance increasing factors: nerve conduction and muscle specific, as well as oxygen delivery and energy. So all of this feeds into better performance. Okay. Yeah. Okay. I think that's sufficient there. So as far as a cool down, we want to ensure that it's a light aerobic activity, again for about 10 to 15 minutes at a minimum, hopefully about 5 minutes after training. One of the big things, if you remember how our venous return of blood to the heart works, is through muscles contracting. So if we have a high cardiac output and we just stop moving as soon as we're done our exercise, what can happen is gravity will cause blood to pool into our legs, and that pulls blood away from our head. So lightheadedness, dizziness, or fainting might occur. Easy way to fix this is, again, a light cool down. If you absolutely feel these things after exercising, sitting down, elevating legs can help for sure. And lowering blood activity and aiding recovery. Hopefully you can recall back to our discussion about the Cori cycle. So that will slowly, again, if we're working at about a 3 or 4 out of 10 RPE, or 30 or 40% of our max heart rate, that should help recover, both helping eliminate lactate or the acidity that lactic acid helps soak up, and freeing some more lactate to go back and soak up more hydrogen protons from our cells, but also aids recovery again through the Cori cycle. So taking some of that lactate, taking some, just making new glucose for our bodies. Okay, right, so again, if we're going to structure our sessions as far as having some sort of stretching, warm up, and cool down, important components to include for sure, but let's, and that's part of the session structure itself. And then you can refer back to the other lectures that we had, specifically speaking about our anaerobic exercise session, what that looks like, and then our aerobic session and what that looks like. And so this would be in and around those two types of workouts, intervals included in that. Okay, so I'm going to lop into here another part of detraining, and then looking at a larger periodization or annual training program, and what those things look like specifically. What does that look like for strength training and then aerobic training? But one thing to consider when we're looking at these programs overall is this concept of detraining and how that occurs and when that occurs. So what it is this loss of physiological adaptations to exercise that we've built up through our training. And then once we stop or reduce our volume, we get a little bit of what's called detraining. Now, this typically occurs in off seasons or when people go on vacation, but can occur during what's called tapering or decreasing our workload as well. Now, depending on the system that we're talking about, these will occur at different rates, but generally our health benefits of exercise will decrease with time. So the longer that you go without exercising or training, you lose any benefit that you had from previously exercising. Okay, so if we're talking about strength training in particular, as soon as we stop, we generally do see a loss of strength and power occur relatively quickly. The general timeline is within about 2 weeks. You'll start noticing that in particular, and we get a loss of type 2 muscle fiber cross-sectional area, but that actual muscle loss occurs a bit longer over time. So if you remember, our neurological adaptations occur quickest, both when we're first starting to train, but now we're also talking about when we stop training. And so that's why power in particular will be lost, because that's a rate or the timing at which we apply force. And so that comes from our motor unit recruitment. And as we start or stop using our motor units that engage our type 2 muscle fibers more and more over time, we'll see that decrease in the muscle size itself. Okay, these declines happen quicker as we get older because our recovery and building it up takes longer as well. So we lose it a lot faster. So, and that'll also happen if we have lower intensity versus higher intensity training, and that applies to volume as well. So we see this loss can happen a lot quicker in a few situations. But that being said, our loss of this type 2 muscle fiber strength tends to come back really quick once we put in the work. So we might, we build it up, eventually we get this type 2 muscle fiber, and then it's our strength might decrease, and even the type 2 muscle fiber cross-sectional area might decrease, but it will increase with retraining quite quickly. Now, again, our maintenance, as I've mentioned in previous lecture about this, 1-2 days a week, depending on who you are and how fit you were originally, might be enough to maintain, but not necessarily improve. So that's kind of a minimal thing. And then you want to at least train once a week to help ensure that performance is not decreased for this. And this would be more, for example, if you're a endurance athlete in season, high training load, you ideally want to get at least some to maintain that strength. So when we're looking at our endurance training specifically, what you tend to see is not a decrease in strength, that's strength training, but we'll see a decrease in our peak O2 or our VO2 max consumption will decrease. And the higher trained you are, the greater decrease in this percentage you see. So you everyone has this like lower level plateau of our VO level that we need to just get around and do our daily activities. And so if you're a not very trained athlete, a percentage of that loss is a lot less than if you're a really trained athlete and you drop down a bit farther. So you have more to lose, essentially, is what happens there. And you get a huge array of losses as far as blood volume. So again, that just comes from your adaptation to trying to keep blood volume high through sweat loss and water loss through glycogen use. So because you're not causing that stimuli anymore, you don't need any use of that. So you don't need to prevent dehydration. Stroke volume, well, you don't need to be as efficient pumping blood around. So heart rate will come up, stroke volume will go out to maintain cardiac output, which its maximum will fall. Again, you have a greater range if you're better trained. And our oxygen delivered to tissues will also decrease. Again, we see some cardiac specific decreases here. This would be longer term cessation of exercise or training, whereas these are a bit more quicker or immediate. They will happen somewhat sooner. A timeline for endurance activities, again, depending specifically which metric we're looking at, usually you'll start to notice these performance decreases occur within 2 weeks. So you have actually a bit more of a buffer with endurance training, actually, so 2 to 4 weeks in particular. And then before you really start noticing some changes, up to about 6 weeks as far as some of these more finite changes that occur, like structurally our left ventricular mass will tends to decrease after quite a bit of cessation, which is a good thing because we want to keep that around. But over time it does decrease. Okay, but performance-wise and training-wise, you'll notice anything from 2 to 4 weeks in particular, unless you have that 1 to 2 times per week where you're increasing or maintaining some sort of exercise. In particular, if you're not keeping up a high volume of aerobic training, you'll need to keep the intensity there for sure. Okay. Yeah. Now, this is the big part here. Periodization. What is it? How does it look? This is when we're talking about a year-long plan and how does our training look over that span of the year or a long period of time. So typically, we can't just train hard and go hard all the time, every day, all year round. I know there's this idea or saying out in the health and fitness industry where there's no days off. Well, that I feel gives a false perception that you always have to train really hard to see any benefit, and that is just not true. In fact, it's better to have times of the year where you do train harder and times of the year where you shift that intensity to maybe duration or change the type of activity altogether. So when you're looking at your fit principle, absolutely positively important to vary that over your year depending on what your goals are. For athletes, it'll look a little different because it does need to stay sport specific to some degree. Even when you're doing your cross training, it's good to find sport or activity that supports that in some way, but as it doesn't necessarily have to be that all the time. And when we have this periodization occurring, we get to play with and adapt appropriately to our sports or our physical activities that are our main focus to allow lack of injury or a decreased risk of injury, as well as maintaining body composition and improving our motor performance, which is what we're after. So if we look at strength and power periodization in particular, most training blocks are about 4, but some are up to 6 weeks. And each training block, if you want to call it that, has some sort of goal and has about a week or 2 of active recovery or plateauing as far as what you're working on, so not progressing or pushing yourself to lift heavier. And often this looks like starting with a high volume of repetition and sets, and then you decrease the repetition and sets to have a high intensity or a high weight you're lifting with a low amount of volume. So as an example here, you'll generally start your training blocks off somewhere in a hypertrophic sense, so high number of reps, higher sets potentially, and then you work towards a training phase or 4 weeks where you really focus on a lower reps, sometimes depending on who you are, a lower number of sets. But the idea is your volume decreases significantly and your intensity flips relative to how you started out. So that is a periodized classic training regime. And we'd rotate through that again on about a 4 to 6 week basis. This probably being about 4 weeks, this being up to 6 weeks. But there's also something called non-linear periodization training, and essentially you go week to week and vary this depending on the muscle group and how you're feeling. Now, the nice thing about a non-linear periodization training is you actually get to adapt a bit to what you or your client's needs are week to week, based off competition, how they're feeling, how they're recovering, etc. And it's a good way to train a lot of different muscle groups. So just to compare the two, periodized or linear and non-linear periodized training for strength, if we have 3 days of the week, just as an example, for our non-linear periodized, you might have resistance on Tuesdays, hypertrophy on Fridays, and then next Tuesday you might have a maximum strength, right? So you just kind of alter back and forth, different sets of recovery, different target groups, again, having our more intense lower rep range, so our 5 RM rep max versus our 15 rep max up here for our general resistance training, which this table would relate closer to, here, I'm just setting this up, our resistance just being considered our hypertrophic range there, okay? So if we were to talk about our linear or our more classic periodized table, we have 1 to 4 weeks resistance or hypertrophic, 5 to 8 being a bit more strength, although that's still within hypertrophy in that range, so this would be a bit more strength endurance, I guess, to correct that. And then, so that's month 1, month 2, month 3. Now we're at our maximal strength, where we're dropping our rep max down, giving a nice long break in between. Okay, so that's just a comparison between the two. Both have pros and cons depending on your goals. Now, that was strength training. On to our aerobic training. So with aerobic training, we have a volume essentially that we look at, and depending on your activity or sport, it will vary what you're looking at. I will show you some examples from some data from my actual training program, just to see what this might look like and what periodization looks like. Normally, there's new metrics that are out there on different apps like Strava and or Training Peaks, which kind of amalgamate a whole bunch of data from your training. There's so much wearable tech now that you can have as an athlete or an aerobic or endurance-based athlete or health and fitness recreational athlete, and it can kind of include and tie together distance and intensity into this one score called a training stress score. Best time typically is not a great way to go as far as trying to measure your training volume or training load. Okay, because there's so many variables that go into a best time or pace for a certain distance. Okay, so I'd suggest looking at those other ones, or total time running as well, or exercising. When you have a typical periodized program for aerobic activity, a lot of the time that's more longer term, because you want to gradually build up this intensity, potentially over about two to 3 months roughly. Now, once you start getting up to about 3 months, if you're just starting out, or even for most training blocks for individuals, you really go from a low intensity, high volume, just kind of like your strength training, into more intense, shorter duration. And that shorter duration usually comes up in the frame of interval work. So interval work typically pushes you up to your lactate threshold or above, and a lot of that will come in past 10 weeks. If you've done that, say for a number of training blocks, usually you can integrate your training like interval work above threshold more so right from the start. So if you have a longer term program, you're going up to 24 months. So that's a 6-year or 6-month programming. And if you're doing something like a half marathon training, it's pretty ideal to have something at least that long to build up to the distance that you want. Anything shorter than that is pushing it, especially if you're a beginner. If you have some level of base fitness and sport-specific training, you can definitely cut that time down quite a bit. Yeah, and some of the training blocks that I'll do with athletes as well will range. There's a couple of different models. So, and we'll talk about how we can periodize this intensity for someone that's a bit more established. And usually what that looks like is anywhere from a 3-in-1 to a 2-and-1 rotation. So you'll have a build where you're increasing the volume either through intensity and duration or duration for about anywhere from 21 to 28 days. So again, that's about 3 to 4 weeks. And then you have a taper. Now, 4 weeks is a very long time for a build. And so most people, or some people, even do so I meant to say 14 to 21. Some people will have a 28 day program, but I typically wouldn't suggest that. So 2 weeks on, 1 week off, or 3 weeks on and 1 week off. That's a better training block to go. And again, that 1 week off or recovery is usually plateau or significantly reduced volume. So for example, you will, actually, I think maybe this helped. Yeah. So for example, you'll have someone build up. Again, this is a longer training block. Maybe if you're starting out or have significant experience, this would be fine. Week 6, but then you have a week of significantly reduced running volume. Okay. And then you can get back, pick up roughly where you left off, build again, and then a week recovery. And so again, these weeks in here would be a bit more realistic or common for a within building period for someone that has some experience. This would be like an off-season base building. The intensity for this individual should be more than able to sustain that and have experience with this for that amount of time. And then this would be like on season. This would be when races are occurring. You want to significantly decrease the time and duration until you get to your off season when all your main races are done. Probably somewhere in here. This is a bit of a maintenance phase because you want to reduce your training so that you're fresher for when you actually go to do your races. Okay. And so that would be a 24-week plan. But to just give you an idea how this might look for a real athlete, I will use some of my own information here. So this would be my last year of training. And just to explain a little bit what's going on, this is a total stress score per day, So what that means is that's a combination between the intensity based off of heart rate and volume, so time at that heart rate or in that heart rate zone. And, that's related to distance a little bit. And what we end up seeing here is this pink line, which indicates how much fatigue. So the higher training stress scores that you have on a certain day, the more fatigue you'll see on these lines. And this is just a metric this particular system chooses to illustrate that. Depending on the platform you're looking at, that'll vary. And then what you'll see decrease is this form. So form is how fresh or how good of recovery your body is. And so naturally, the higher fatigue you have, the lower form you have. And the goal is, before you start racing and competing, you want your form to be high, such as here, and your fatigue to be low, while trying to keep your fitness up. Okay, so the fitness is the kind of the culmination of all your previous exercising and recovery. Okay, so if you look over the span of the year, this would be off season. The fitness line kind of trucks along in a plateau, and then you start ramping up your training. So that would be that incline. During race season, you want to try not to keep building up your workload. You just want to maintain your fitness. So you're racing and recovering, trying to keep some training up, but going. So this is pretty much your peak at which you're going to ramp up your training. And then, of course, you get to your A race somewhere in here, and then you get into recovery and off season, where you do cross-training activities that are maybe related to your training program, but not. But just to tie together what you're seeing kind of here in these 3-in-1 blocks here, this is what it looks like in real time. So again, you'll notice that there's an increase. So this would be like over, let's say, those 3 weeks, big week of training, and then a decrease or plateau. Okay, so you notice what happens, that it allows your form and recovery to come up. The amount of fatigue you put on your body comes down. But you notice over that time, as we talked about detraining and stuff, there's only about a week or 2 max, usually just a week of recovery or plateau work. So then you don't really lose fitness, but you're recovered, so you're able to take another ramp up in your training, big fatigue load, lots of exercise, lots of volume, lots of intensity, and then again, a little bit of a break, probably a week off. That was probably about a week to bring my fatigue down, recovery up, back up to a bit more training, and then there's probably a race coming up. So I did something called tapering. Okay, so before a race, again, to allow this fatigue form to come up and fatigue to come down, you can do something called tapering. Okay, that's right here. So it's a planned reduction in the volume of training or the intensity of training. Now, usually if you're doing an aerobic sport, you actually eliminate strength training altogether for that week, or keep it very, very light, focus on mobility, and really hone in on your aerobic activity. Okay, so again, this is about a year. This would be September, sometime in here. So that's usually when the main races are done. You don't have to worry about keeping your fatigue up. You can really let your volume and intensity drop down, form comes up, and then you're just into maintenance again until the next spring, ready to compete. Just to show you one more illustration. So this is our training stress score, all these red dots. All these blue dots are the intensity factor at which those are done at. So you can see where the training stress score is really, really high for that day, fatigue comes up too. So again, this is for the past year. Now, if we were to look at something over a couple of years, you can see here, there's lots of building occurring in this year, peak, recovery, off season, and then ready to build again, okay? Yeah, I guess just to share one more way that we can look at this intensity over time. Now, this is only over the last 28 days, so this is a maintenance phase, but you can see here, zone 4 work of heart rate, so you would know that as zone 3 if you use a 3-zone system. I use a 5, zone 3, zone 2, zone 1. So lots of base in zone 1 and zone 2 relative to how much zone 4 or high intensity work is being done. And this goes all the way back to October when there's still some very high intensity training going on. Okay. Yeah, so if you're trying to build your aerobic work and time over the course of your training period, you might look at some data like this for an athlete where you can see, okay, well, for this training period, I want to see more anaerobic work, so zone 4, maybe some sprint work in zone 5. So I want to try to decrease some of this work to increase intensity. Being in the off season over the last week, lots of base training in zone 1, 2 in particular is great. Trying to minimize 3 and 4 just in the base season. Okay, so hopefully you got a good idea of what we're looking for as far as endurance training here. Again, with strength, we're really looking at focusing on generally looking at one type of training for a training block and then slowly increasing up to the peak. And I think most important out of both of those training programs is rest and recovery, okay? Having a training block where you build some intensity, build volume, build time, distance, whatever the metric is that you're following for that particular activity, and then having some time to rest and recover, allowing the body to actually adapt before giving another training stimuli. Okay, I could talk to hours and hours and hours about this stuff, but those are the main key points here for you to know and understand about program planning and session planning. Cheers.